Ever wondered how the food you eat directly impacts your health? Every meal you consume plays a crucial role in determining your overall well-being. But for some, certain foods do more than just nourish. They trigger serious health conditions. Take, for instance, celiac disease, a stark example of how something as commonplace as wheat can lead to significant health issues. This autoimmune disorder is exacerbated by the very diets that sustain others. It's a poignant reminder of the powerful and sometimes hidden impact of our dietary choices. Let's dive into what celiac disease really is, and why it could be more common than you think. Celiac disease is not just a food allergy, it's a serious autoimmune condition. Imagine your immune system, which typically guards against harmful bacteria and viruses, mistakenly identifying something as common as gluten, a protein found in wheat, barley, and rye, as a threat. This response triggers an assault on your own body, specifically the small intestine. Here, the tiny finger-like projections called villi, which are crucial for nutrient absorption, become damaged or destroyed. Now, because celiac disease is an autoimmune disorder, its impact can vary significantly from one person to another. For some, consuming even the smallest trace of gluten can trigger severe symptoms, while others might not notice any symptoms at all. This variability can often make celiac disease quite challenging to pinpoint without a medical diagnosis. A key factor in the development of celiac disease is genetic predisposition. It's often seen in individuals who have family members with the condition, suggesting a strong hereditary component. However, having the genes associated with celiac disease doesn't guarantee its onset. Environmental factors, particularly the consumption of gluten, play a crucial role. It's the combination of genetic makeup and the exposure to gluten that typically leads to the development of celiac disease. The prevalence of celiac disease has been rising, which could be attributed to better diagnostic methods and greater awareness. However, it's also possible that changes in wheat cultivation and processing over the years may have increased the amount of gluten in dietary sources, contributing to more frequent triggers of the autoimmune response in susceptible individuals. Understanding the nature of celiac disease underscores the importance of awareness and recognition, not only for those who suffer from it, but also for their families and surrounding communities. Education and understanding can lead to quicker diagnoses and more effective management, reducing the risk of long-term complications. So, what triggers this reaction in the body? Let's find out. Let's imagine your body's immune system turning against itself. This isn't a scene from a sci-fi movie, but a real-life scenario for those with celiac disease. Here, gluten, a protein found in wheat, barley, and rye, plays the role of the antagonist. When someone with celiac disease consumes gluten, it triggers an unusual immune response. The immune system mistakenly identifies gluten as a threat. In an attempt to protect the body, it attacks the small intestine, specifically the villi. These tiny finger-like projections line the interior of the small intestine and are crucial for nutrient absorption. They work tirelessly to absorb vitamins, minerals, and other nutrients from the food we eat. However, when the immune system targets these villi, it causes inflammation and damage. This damage impairs the villi's ability to function properly. Imagine trying to catch rainwater in a sieve. That's how the damaged villi struggle to capture nutrients. As a result, no matter how nutritious the diet, the body may not absorb the essential nutrients effectively. This malabsorption can lead to a host of problems, including anemia, delayed growth, and bone density loss, among others. The severity of the attack can vary greatly. Some people might experience mild inflammation, while others could face severe damage leading to total villus atrophy, where the villi are completely flattened. This variation contributes to the wide range of symptoms and severities seen in celiac disease, making it a particularly insidious disorder. This internal battle not only damages the intestine, but triggers a range of symptoms. The signs of celiac disease can be as subtle as they are varied. For those not familiar, celiac disease is an autoimmune condition where the ingestion of gluten leads to damage in the small intestine. But how does this manifest in everyday life? Let's delve into the symptoms that are often indicators of this condition, distinguishing between those seen in children and adults. In children, celiac disease symptoms are predominantly gastrointestinal. These young ones may suffer from chronic diarrhea, which can lead to significant discomfort. Abdominal pain and bloating are also common, making mealtimes a challenge rather than a pleasure. Additionally, children might exhibit weight loss and fail to thrive, which can be particularly alarming to parents. Switching gears to adults, the presentation of symptoms can be more diverse and often less overtly linked to digestive issues. One major symptom is unexplained iron deficiency anemia. This can manifest as persistent fatigue, weakness, and in some cases, severe headaches. Adults may also experience issues like osteoporosis or osteopenia due to poor calcium absorption. Furthermore, unexpected skin rashes, specifically dermatitis herpetiformis, can appear, which are intensely itchy and blistering. It's also worth noting that both adults and children can experience joint pain, dental enamel defects, and mood disorders such as anxiety and depression, which are often overlooked as signs of celiac disease. Understanding these symptoms is just the beginning. Spotting these symptoms early can be crucial. But how is celiac disease diagnosed? Diagnosing celiac disease involves a combination of tests and careful observation. When someone presents symptoms that suggest celiac disease, such as digestive discomfort, chronic fatigue, or skin rashes, the first step typically involves a detailed medical history and a panel of blood tests. These tests look for specific antibodies, such as anti-tissue transglutaminase, TTG antibodies, which are highly indicative of an immune response to gluten. However, a positive antibody test is not enough for a definitive diagnosis. The next crucial step is an endoscopy. This procedure allows doctors to view the small intestine and assess the damage to the villi, the tiny hair-like structures that line the intestinal wall and help in nutrient absorption. If the villi are flattened, a condition known as villus atrophy, it strongly supports a diagnosis of celiac disease. Often, to confirm the diagnosis, a biopsy is taken during the endoscopy. Small samples of intestinal tissue are examined under a microscope to check for the degree of damage to the villi. It's crucial because the extent of villus atrophy can vary greatly among individuals with celiac disease. Once a diagnosis is confirmed, managing celiac disease becomes the next immediate focus. The cornerstone of management is a strict, lifelong gluten-free diet. Gluten, a protein found in wheat, barley, and rye, must be completely eliminated from the diet. This is not merely a dietary preference, but a medical necessity. Adhering to this diet helps prevent further damage to the intestines and can alleviate many of the uncomfortable symptoms associated with the disease. Moreover, embracing a gluten-free diet can lead to the healing of the intestinal lining over time, improving nutrient absorption and overall health. Patients are often encouraged to consult with a dietitian to navigate the complexities of gluten-free living and to ensure their diet remains balanced and nutritious. For those who continue to experience symptoms despite following a gluten-free diet, further evaluation may be needed as they might have what's termed as non-responsive celiac disease. Additional medications or treatments may be required in such cases. Sticking to a gluten-free diet is not just beneficial, it's necessary. Avoiding gluten is challenging, but not impossible. Navigating a gluten-free lifestyle when diagnosed with celiac disease does come with its own set of hurdles. One of the main issues is the hidden gluten found in many processed foods. Gluten, a protein found in wheat, barley, and rye, can often lurk in places you'd least expect, like sauces, soups, and even some medications and lip balms. This makes vigilance a constant necessity. Another significant challenge is cross-contamination. This occurs when gluten-free foods come into contact with gluten-containing foods. It can happen anywhere from kitchens to manufacturing plants. Even a tiny amount of gluten can trigger symptoms, making it crucial to ensure that food preparation areas are thoroughly sanitized and that products are clearly labeled. So, how can one manage these challenges effectively? Firstly, it's essential to become a label-reading expert. Understanding ingredient lists and recognizing names that indicate gluten is key. Additionally, many countries require clear labeling of gluten-containing ingredients, which can be a helpful guide. Secondly, consider embracing whole, unprocessed foods. Fruits, vegetables, meats, and dairy typically do not contain gluten, and incorporating more of these into your diet reduces the risk of accidental gluten ingestion. For those times when you need to rely on processed foods, seek out those that are certified gluten-free. Many brands now offer products specifically designed to be safe for those with celiac disease. Lastly, education is your best defense. Connect with local or online celiac disease support groups and stay updated with reliable resources that can offer guidance and support. With the right knowledge and tools, managing celiac disease is manageable. To wrap up, let's summarize what we've learned about celiac disease. This condition is an autoimmune disorder where gluten triggers harmful responses, damaging the small intestine's lining. Symptoms vary widely, from digestive distress to neurological issues depending on the individual. Diagnosis typically involves blood tests and a biopsy. The cornerstone of managing celiac disease is a strict gluten-free diet, which helps mitigate symptoms and promote intestinal healing. Remember, awareness and education are key to managing this condition effectively. Stay informed and stay healthy.